My name is Genesis Morgan, and I'm going to be performing the medication administration checkoff. So to begin with, I would I would try to avoid any interruptions during the medication administration. And to do this, I would not take any phone calls. I would close the room door. I would limit all contact with other colleagues to only important concepts, and I would also utilize the institution's no interruptions on policy. So to begin with, I would compare the MAR to the patient's chart. So Jaguar J. Jones, the medication is heparin, 5,000 units, subcutaneously, every 12 hours. And I'll also see that the patient has an allergy to penicillin on both the MAR and the patient care order form. So next, I will perform hand hygiene and select the appropriate medication, which is heparin. The expiration date is 12/5/2025, so it is not expired. Then I would verify the time. Patient has not received the medication within the last 12 hours, and I would select the correct syringe for a subcutaneous injection, which is the tuberculin syringe, since we're administering heparin. Now I'll clean the top of the vial with an alcohol swab. And while that's drying, I will perform my math to calculate the dose that's needed. And I get 0.5 milliliters. So now I will draw the medication. And I have 0.5 milliliters in the syringe. Next, I would go to another nurse and have them verify that I have the correct medication and the correct amount in the syringe. And then I would take this and compare it to the MAR. So I have heparin, 5,000 units, which is equivalent to 0.5 milliliters. I have 0.5 milliliters. Subcutaneously, I have the correct syringe for a subcutaneous injection. Every 12 hours, patient has not received the medication within the last 12 hours, and the patient is Jaguar J. Jones. Next, I will prepare a label with the patient's name, the medication, and the dosage amount. And I would place this label onto the syringe and take it with me to the patient's room. So now I will proceed to the patient's room with the MAR and the syringe. I would perform hand hygiene, and I would verify the patient using 2 identifiers. So Jaguar J. Jones, date of birth 8/25/1963, date of birth 8/25/1963. I see that he has an allergy to penicillin, and I would also ask if he has any other known allergies. Then I would do any pre-administration assessments that are required for the medication to be given, and then I will perform the final check. So Jaguar Jones, the medication is heparin, 5,000 units, which is equivalent to 0.5 milliliters. I have 0.5 milliliters. Given subcutaneously, I have the correct syringe for a subcutaneous injection every 12 hours, and the medication has not been given within the last 12 hours. So next, I would explain to the patient the procedure, and I would tell them that I'm going to be administering heparin. I would raise the bed to a working height and lower the side rail, and then I will put my gloves and goggles on. Okay, and now I will reveal the injection site, and for this injection, it will be given in the abdomen, maintaining a 2-inch border around the umbilicus and being sure to not go past the left and right anterior iliac spine or below the pubic region or above the intercostal space. So I will clean the injection site with an alcohol swab. And pinch the skin. And inject the medication slowly. And then I would apply slight pressure to the injection site, being sure to not massage the area. And then I would return the patient to a comfortable position and raise the side rail and lower the bed. And then remove my gloves. And throw them in the trash. And then I would perform hand hygiene, and I would document how the patient tolerated the procedure, and I would also document the medication administration onto the MAR, and I would remain in the room for a few minutes to ensure that the patient doesn't experience any allergic reactions to the medication.